Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello and welcome to Sensei Podcast. It is my pleasure to introduce Dr. Mitul Patel, who is a clinical professor of medicine at the University of California, San Diego, and a great friend and CTO and complex interventionist. So thanks again, Mitul, for taking part on the Sensei Podcast.
Well, thank you, Manos, so much for having me. It's an honor and a pleasure to be here.
It's our pleasure, and it's been always fun to ask people about how they started doing this, because there's many people who start doing CTO, but as you know, not everyone continues to the next level, which you've done so well. So you want to share with us, how did this happen for you? How did you decide to become a complex CTO PCI operator?
Yeah, so it's a very interesting initiation into the field, and I know you started your career at a VA hospital, and when I was in my training here at UC San Diego, part of our rotations were through the VA, and as you know, Manos, there's so much disease you find in that patient population, a lot of calcification, high risk lesions, and a lot of chronic total occlusions. And so that's where I was first kind of introduced to the CTO space. My attending at the time, both Bill Penny and Patrick Hugh, would teach me some of the nuances. I from that learned that it's actually something that I have an appetite for and that I enjoy and get a lot of gratification out of. The acute MI going from a closed vessel to an open vessel gives me a lot of gratification, and it gave me the same feeling in the chronic setting. So from there, I kind of explored some options, and I think a lot of us work very closely with the medical device industry, and I was fortunate to be introduced to not just you, Dr. Brilakis, but also Dr. Lombardi when he was up in Bellingham, and went up to one of his courses, and that really kind of accelerated my enthusiasm for this space, just knowing that if you can do this, you can pretty much do anything in the coronaries. And then you came down and proctored my first retrograde CTO, and so I have you to blame and thank for now my addiction to this complex CTO space.
Well, there are much worse addictions, so I guess that's a good thing overall.
Yeah, absolutely. Good point.
And then so you went, you had some people come down, you went and saw some cases, and then you just learned on the job essentially, and obviously these were the early days of CTO, but how did you get your skills up to speed? How did you learn?
Yeah, so it started, as I mentioned, with your proctorship and other proctors also coming in to help us early on kind of get our program up and running. And then once, you get about, let's say, 50 cases, I think, under your belt, you start reaching this plateau and you need to get to the next plateau. And I think the way to really accomplish that, or at least the way that I accomplished that, was a lot of education, things like CTO Summit, which is now CTO Plus, I believe, and courses like that where you go and you attend, you not just interact with a lot of the worldwide experts in the space, but you see them perform, you see the live cases, you're introduced to all the newest and greatest technology and techniques, which, sitting in the audience kind of makes you antsy and makes you want to get back to your cath lab and start employing a lot of these things with the help of a lot of our mentors, such as you, Bill, Mike Wyman in my neighborhood has been very helpful to me and a mentor as well. So I think that's kind of, and then, those plateaus keep coming, but things change every year. So if you're not actively educating yourself and interacting with your colleagues, not just nationally, but internationally, you're never going to get to the next plateau.
And what were the things that you found most difficult to learn in terms of CTO or complex in general?
Yeah, I think all of us have certain fears, right? And my mentors have taught me that fear is a healthy thing in the cath lab. If you're not fearful, then you're not respectful, and if you're not respectful, bad things can happen. But I think it was, I would say that doing retrogrades for the first time in a lab where perhaps you don't have that mentor standing next to you. It was easy to do when you were there, Manos. I'll admit. You just talked me through it, and we did it. But then doing it without that person standing over your shoulder, I think was a big step, and I think that was kind of the first hurdle. Dissection reentry has its challenges as well, and unpredictability as well. But doing my first retrograde without any proctor around, I will say, I'll admit, actually, it was not an easy thing to do.
And then, how do you deal with the challenges and the complications happen to everyone in every lab, but they can be a problem, especially early on in your learning curve. So, how did you handle that, and what was the local ways to deal with this?
Yeah, I think early on, it was very important for me to have buy-in by my partners and cath lab director, my mentors, local mentors here, Shemi Mahmood, was very supportive in starting these types of programs. And as we recommend nowadays, we scrub these cases together, at least at the beginning. So it helps if you don't have a large denominator of PCIs under your belt at the time. It really helps to have someone with you that does have that, not just for the for the diffusion of the potential complication, but also the experience, right? Many times, the perforations have occurred outside of the CTO space, vascular complications, hemodynamic compromise, etc. And it really helps to have another mind there with you that perhaps may not be as fatigued at certain points in the case. So I think it would be a lot more challenging if I would have had to get this going in an environment where I didn't have someone experienced that was supportive. It wouldn't have been impossible, but the hurdles would have been greater, certainly.
And then as you kept on maturing and doing more and more complex cases, do you feel that there is kind of a plateau that you reach at some point, say, look, I've learned what I need to learn, or do you still feel you're learning? How are you evolving right now?
Yeah, that's a great question, and I think that's the reason why our field is so exciting, Manos. There's always room to learn, and I know this is called the Sensei podcast. I think it's very fitting. My kids are in martial arts, and their sensei teaches them all the time. The biggest room is a room for improvement, right? And so all of us have room for improvement. No matter how good we are or we think we are at what we do, there will always be something that you're not perfect at or you're not an expert at. And I think if we stop trying to improve and somewhat trying to evolve, that may be the time to hang it up, to be honest with you.
Well, I guess it's still quite early for that step, but having said that, how have you learned over the time to deal with the stress of the cases? Do you feel stressed or anxious during cases now, or you're more comfortable since you've done quite a few of those cases? How do you feel before and during those cases? Yeah,
I think attending many of the live cases, attending many of the complications courses have somewhat diminished some of the fear and anxiety. As I said, I think it's a little healthy to be fearful. All of us carry a little bit of that with us, but I think if you are allowing that to limit helping people in the way that you are qualified to help them and in the way that they need help, then maybe you need to either involve someone else in your case or even refer your case to someone else. And I'm certainly not one that has the ego to think that if I can't do it, no one can do it, or it shouldn't be done, which unfortunately runs rampant in our specialty, but shouldn't. But yeah, the way I handle it is preparation, and I diminish some of the fears by talking to the patient and the family and just helping them understand the potential consequences, And I think we all know, thanks to a lot of the work that you've put forth, Manos, we know percentage-wise what certain complication rates are. We know perforation is probably the scariest complication, and the one that's most likely to result in a patient not walking out of the hospital. So, we can find ways to diminish that risk, of course, with our techniques, but also the patient's family being informed as to that risk. I think that reduces a lot of the fears, and also having a good relationship with that patient and their family. It's very difficult if you've never seen this patient before and you just walk into a case. So, that's one of the things that I really try to drive home to all of our trainees is, listen, no matter what you're going to do, just make sure that the patients know who you are, make sure you know who they are, and make sure that they understand what you're about to embark on.
Perfect. And how do you prepare, Mitul, how do you prepare now for the cases? Are there some specific things you do apart talking to the family, looking at the films? Is there anything special that you've learned over the years and you consistently do?
Yeah, and it was started initially from my mentors that you and Bill and others taught me, is studying that angiogram, and 15 minutes, 20 minutes, whatever it takes, study it and understand all of your options really well. And this is all assuming you've already spoken to the patient and made sure that there's a good, strong indication for doing what you need to do. And, once you have that and you've studied the angiogram, I think the newest, probably the newer things that we're doing more often, and many of our patients have had coronary CTs, really looking at that CT and understanding perhaps the course of an occluded segment, so things like that can help you. Understanding their peripheral anatomy and your approach, what you're going to take, femoral, biradial, whatever it may be. That and just making sure that all of your ducks are in a row, equipment-wise, as well as has the patient been optimized on medical therapy? It's probably not something that we should embark on procedurally if they are doing well on medical therapy.
Wonderful. And then when you actually do those cases, and you have a tradition in your lab looking at radiation protection and different ways to reduce it, are you doing anything special for CTOs, or it's just like the other cases?
Yeah, another great advancement, right? I mean, I think we have certainly benefited from reducing our frame rates for fluoroscopy, taking less cines and doing more fluorostoring. We are in the process of remodeling our labs right now with the plan to implement the Rampart system for further protection. That's more orthopedic-wise, but radiation protection for us significantly. So we haven't, other than just reducing our fluoro rates, reducing the number of cines we're doing, until the rooms are remodeled, no drastic changes, but certainly being conscious of all of that, especially because many times this isn't the first or only trip to the cath lab for the patient, much less ourselves, obviously.
And then along the same lines, you say it's a lead, it can be a long day in the lab. How do you keep in shape? Do you have a specific routine? Do you exercise? How do you keep yourself fit for all this? Mentally and physically.
Yeah, no, and I think that's something, Manos, that's really come to light now with so much burnout, et cetera. Obviously, that's the mental aspect of what we're doing, but the physical aspect is very important. I'll give you a personal anecdote. My father is now a retired interventional cardiologist. He's been through multiple lumbar spine surgeries as well as cervical spine surgeries from days of wearing heavy lead. And in learning from that and wanting to avoid that, because I've seen him very miserable at times from neuropathy, really exercising in terms of back strengthening type of exercises, obviously staying in good cardiovascular health as best as I can with elliptical, running, bicycling, those types of things. But I think some of us forget that strengthening resistance exercises for not just our lower back, but upper back. I have a shoulder issue right now. I'm doing physical therapy. In fact, I did it earlier today. And one thing you realize is if you're not taking care of your joints and your muscles, it may significantly shorten our careers. Now, hopefully, shedding the lead will allow us to avoid some further injuries and potentially prolong our time in the cath lab. But I think it's very important for operators that are doing these complex cases, long cases, to take the time and also take care of themselves. Because if you're not there to take care of the patient, then there's no point.
And then when it comes to train the fellows that you have in your lab and work with them, what are the things that you look for when you choose an interventional fellow or someone who is interested in complex PCI? Yeah,
that's always, my colleagues and I sometimes conflict on what we look for in an interventional fellow. And, to me, pedigree is a lot less important. To me, there's two very important things: work ethic and enthusiasm. If you have work ethic and enthusiasm, everything else can be taught. But I cannot motivate someone to have work ethic. That's not something, that's either something that you have or you don't, at least at this stage, And so I've always said I'd rather take a hardworking person that knows very little knowledge-wise, which is rare, obviously, in cardiology. Almost everyone knows a lot because it's such a competitive space. But work ethic and just I love working with the fellows that you can sense their sense of excitement before the case even starts, and they're just we've been fortunate. We get them every year, and maybe some of it is infectious from the faculty. I don't know, but I think those are the two characteristics I really, really look for and enjoy in a trainee.
And then when it comes to the teaching part of it, do you follow a specific curriculum? Is it just looking at every case separately? Is there a checklist that you recommend for them to use? How do you just make sure that they cover most bases that they can cover?
Yeah, I think we have transitioned into, I think we learned a lot from structural interventions, for example. Before TAVR, you kind of review as a team, you review the CT, review the data, the access, all of that has kind of been determined. And of course, we were doing this a lot for CTOs beforehand as individual operators, but now in training programs, we're starting to implement similar strategies where we sit down, review the angios together, discuss kind of the approach, the initial approach, and plans A, B, and C, and then kind of have a plan in place. But I think that's very important, and not just with the trainees, but I think it's important to do with your lab staff, right? Because many of them are going to be the ones that are running to get the equipment that you need, and they should also be aware of how the case is going and what they need to be looking out for, not just equipment-wise, but hemodynamic derangement-wise, et cetera.
So do you do some sessions for the staff as well, the techs and the nurses that work in the lab?
Yeah, so we have monthly sessions with our cath lab staff, and it's different topics, obviously not just CTOs, but things like hemodynamic support, things like complication management, perforation management, steps to take, et cetera, et cetera. So yeah, I think that's invaluable. And they, if you ask anyone that works in a cath lab, I think 10 out of 10 of them will tell you that that's absolutely invaluable for them.
So what are you most excited right now in terms of PCI?
Well, I still, I think we've got some new technology in the lab. I think I still feel like the CTO space has a long ways to go. I think we can still improve. I mean, I know that we're getting up to 90% now success rates in most big registries, but I think we can be better. I think, the calcium management tools, things like lithotripsy and whatnot, have definitely made an impact. I think that there will be some additions in that space, not just for balloon-mounted lithotripsy, but catheter lithotripsy for crossing lesions and those types of things. So I'm really excited to see kind of where that space goes. I feel like every month there's a new microcatheter or dual lumen microcatheter that's available. And I'm always the third or fourth line person to get it because Manos has already tried it, and they always tell me, well, Manos loved it, so But I think
it looks like I must love everything.
No, not everything. I mean, well, of course, if it's coming from the company, then you love everything, right? I have to actually talk to you to make sure you love it. But yeah, no, I think the really exciting thing about complex coronary revascularization is that because there's such a need for it, it's a constantly growing space that everyone pays attention to.
And then what are you most proud of so far in terms of both, professional and personal?
Yeah, I mean, I think I'm proud of the fact that I have been able to do a fair number of these, I would say a large volume of these with very acceptable complication rates. There have been very few of our patients that have had to go to emergency surgery. Now, some of that is maybe I'm reaching a point where, and I always tell my patients, there may be a point in the case where the next step could be detrimental. And the line I use is, you walked in here and I would prefer that you walk out of this hospital. And I may not take that next step. So, that's where the discussion of how miserable are you needs to happen. And I can say that I've had some cases where patients were near suicidal with angina. And in those cases, I pushed the envelope, and there were some complications occasionally. But for the most part, I think the complication rate has been very low for what we've been able to accomplish. And I'm proud of that, and I'm proud of the growth. I'm proud of where we started, from where we started to where we are now. I think that, and I owe that to my mentors like yourself, Manos. You guys have taught me so much over the years that I'm just proud I've been able to absorb most of it.
Well, absorb and actually advance it and get it to much better, which is the best. But how about a book? Do you have a favorite book or a favorite movie?
Let's see. Non-medical book, I really like Outliers. Malcolm Gladwell's Outliers. It teaches you a lot about personalities. It teaches you a lot about what drives people to be excellent at what they do, or to be an expert at what they do. And that's kind of, all of us have heard of the 10,000 hour rule, right? That was the first that I was introduced to that. And it teaches you a lot about the psychology of what drives people to excel. There was another book by Tim Grover, I'm blanking on it. He was the trainer for Michael Jordan. And I think it was called Relentless or something like that. But it was it's another book a lot about like sports psychology and what pushes you to excel. So those kind of nonfiction books I've really enjoyed. In terms of movies, wow, they're too numerous to count, I would say. But I'm famous for, I don't know, maybe infamous for quoting movies in the cath lab. And one thing I can tell you, Manos, and I don't know, maybe you can relate to this in this way or others, but now the fellows don't understand any of my movie quotes. So it's a sign of how old I've become, I guess. And so
distinguished.
Yes, distinct. Thank you. Or chronologically gifted is another term for it. But yes, I think movies like Top Gun, Maverick, I think those are movies that have a lot of similarities with what we do in the cath lab. So those are the kind of movies I like.
And then in terms of the mental part, I know that you're an avid skier. You have a lot of experience there. What do you do to kind of relax and unwind and keep you mentally fit for the cases?
Yeah, so you mentioned skiing. I love skiing, but of course that's just seasonal. So I live in San Diego. Unfortunately, I have not picked up surfing, but I do a fair amount of exercise, things like running and like high intensity interval training type of stuff to kind of diffuse. Lately, and this is the most humbling thing I've tried in my life maybe, is I picked up the guitar. And, I felt that I had good hand coordination, being able to do different things with different hands. But I think the one thing I'm missing really is rhythm. And so it's like, it's been a challenge, but that's my new challenge. So yeah, my brother, who's a avid guitarist, gave me one of his guitars and an amplifier, and I've been taking some lessons. And trying to use the other side of my brain and get some, artistic input in there. So we'll see. I'll let you know how that's going the next time we see each other.
Well, hopefully we'll have a little concert at the next meeting. I mean, you never know.
No, please, no. I'd rather do a live case than a live concert. Thank you.
Or maybe both. I mean, you never know.
All right.
So, what is next? So you've done a lot of things. Many works on the clinical world, pushed the envelope, developed a great program. What is the next frontier for you?
Wow, that's I do a fair amount of work in the CTEPH space with balloon pulmonary angioplasty, and I think that is going to grow, and I'm eager to kind of help lead the growth in that area. I think being at UC San Diego, we have special expertise in the area of chronic thromboembolic pulmonary hypertension. So, our surgeons have done a phenomenal job over the years with pulmonary thromboendarterectomy. And about 7 years ago, we went to Japan and learned from Dr. Hiromi Matsubara, and have kind of developed our own way of doing things here that's taken off. And we're, I think, probably the highest volume balloon pulmonary angioplasty center in the country now, and just continuing to grow. And that's a space that a lot of people are getting interested in, and a space that has a lot of innovative potential. So I think that may be where I spend a lot of my time, between that and CTOs.
Perfect. So if a young fellow came to you and asked you for your advice how to become very good, like kind of emulate yourself and try to become the best he can be or she can be, what advice could you give them in 2023?
Yeah, I mean, I think it's to always seek. I mean, none of us are perfect, but if we're not trying to be perfect, then we're never going to get better. And I think that's one of the messages is, just work your tail off in trying to get better every day. Learn something new every day. I always tell the fellows, even if you're not the primary operator in a case, you're scrubbed, you're going to learn something. You just have to stay awake and stay engaged. So, and just maintain the characteristics that got you there. And typically, as I mentioned before, those are hard work, enthusiasm, and drive. And I think as long as you maintain that, that and the other piece of advice I give to every trainee is treat every patient, and it's completely cliche, but it holds true. Treat every patient like they're your family, and you will always do a good job. I think that's uber important for what we do. If you wouldn't put a left main stent in your father or grandfather without IVUSing it, you should absolutely be doing that for every single one of your patients.
Absolutely. Well, Mitul, thank you so much. Again, this was phenomenal. Great piece of advice, practical information that anyone can use. Again, thanks again for sharing your insights with us. Thanks for being a role model and example for the incoming fellows and trainees. And again, thanks for everything, and look forward to continue working with you.
Thank you, Manos. I appreciate it. And thank you for everything you've done for me. Appreciate it.
Thank you for listening to the Sensei podcast.